What we often think of when we think of pelvic floor dysfunction is urinary incontinence. So this is any form of unexplained loss of urine, often related to coughing, sneezing, laughing, maybe running or jumping or picking up your toddler. Other forms of pelvic floor dysfunction might include fecal incontinence, chronic constipation, any uncontrolled flatulence, also pelvic organ prolapse, which means any sort of heaviness or pressure in the vagina. Pelvic floor dysfunction can also come in the form of sexual dysfunction, and this can include pain with intercourse, which might be pain on insertion, pain with deep penetration. A very common concern that we hear postpartum is diastasis recti, or umbilical hernia, so separation of the abdominal muscles. Lastly, a type of pelvic floor dysfunction that's often overlooked is uterine dysfunction, and this can come in the form of dysmenorrhea, endometriosis, or polycystic ovarian syndrome. It's important to recognize that while all these conditions are common, they shouldn't be considered normal, and there's absolutely things that we can do to help. To go into a bit more detail about core dysfunction and diastasis recti, diastasis recti is a separation of the linea alba, so the left side and the right side of our abdomen and deep core. It's important to note that the linea alba itself is nerve-free and therefore should not be painful. Diastasis recti is very common during pregnancy. Approximately 25% of women will start to experience diastasis in their second trimester, and that increases to about 2/3 by the third trimester. Of those, approximately 50% will continue to have concerns after 6 weeks postpartum. Diastasis recti causes loss of anterior muscle control, which can result in failed load transfer, so challenges with different movements through the abdominal and lumbopelvic units. Pelvic floor dysfunction can be caused by a variety of factors. This can include muscle imbalances, both length and strength in the pelvic floor, our deep core, and other related structures. It's important to remember that our muscles have to be able to both relax fully and contract fully, and this occurs everywhere in the body. It might be related to either direct or indirect trauma to the pelvic floor, and this can include either physical trauma or mental and emotional trauma. Physical trauma can be in the form of childbirth, can be in the form of a car accident, a broken bone, or past surgery. And mental emotional trauma can be related to a whole host of things. Physical trauma is something that we as physiotherapists often treat. Mental and emotional trauma can be guided by a psychologist or psychotherapist or other form of counselor. Scar tissue and adhesions. So scar tissue, any sort of abdominal scarring, any sort of pelvis or pelvic floor scarring can influence pelvic floor dysfunction. This might be related to a C-section or perhaps a surgery you had to remove your gallbladder 15 years ago. Dysfunctions can be related to poor posture, and posture can be in the form of thorax, head, neck posture, pelvis posture, or even knee and foot alignment and mobility. So if we think of thorax posture, if we're doing an exercise or a movement and we're in a really extreme rib flare, this is going to lengthen the anterior section. This is going to compress the posterior back section and can create that imbalance through the front and the back, leading to dysfunction. Dysfunctions can also be related to poor core control and coordination. So maybe it's just the coordination between the breath and the pelvic floor, or being able to coordinate muscle activity during movement. We might have dysfunctions related to breathing patterns and pressure dynamics. So if we think back to the relationship between the breath and the pelvic floor / core function, when we breathe in, our diaphragm contracts and it lowers. This increases the pressure in the abdomen, and we ideally want that equal pressure distribution, front and back, side to side, and down. When the pressure dynamics are not equal, this creates an imbalance, and that can lead to dysfunction. We might see dysfunctions related to neural mobility and/or irritations. This can be in the form of a heightened sympathetic nervous system response. Our sympathetic nervous system is responsible for our fight-flight, and when we're in a state of sympathetic upregulation, our body tends to be stressed, hold on to stresses in certain spots, and then those areas can't lengthen and relax, which is necessary for overall core control and function. We might see dysfunctions related to digestion or organ irritation or even disease. And this goes back to the body's ability to be able to lengthen and shorten. Also, the body's ability to spread pressure equally throughout the body.